reason why we formed the ISSG back in 2009 was because several entities have evaluated patients with adult spine deformity, and there were several multi-center study groups, but we believed we could improve on it based upon the errors that they have made or the direction that research was going. So much of this represents where in the ISSG we're going beyond research, now going into patient education, going into physician education, going into advanced and fellowship training, but then also going into patient advocacy. And so the attendees here at the meeting, we all want them to be able to interact, and hopefully this becomes a venue where people are able then to secure a job, to get a fellowship, to get advanced training. So this acts as a springboard, not only for research, but also profile for patient advocacy as well as education. As much as we have impacted care for adult spine deformity, we have set the standard and provided a transformative way to evaluate, treat patients with adult spine deformity. But I'm really most proud of everything that's happening here in the background for all of us to come together and unite, fly across the country, and put this course together. It's amazing.